Colleagues, good afternoon. I believe we are ready to get started this afternoon. So allow me to call the room in and welcome you. So to those of you who have joined us in the room, a great welcome. We are gathered here at the beautiful and historical campus of the American University of Beirut. And we are here on the sides of an important meeting. This is one of a global series of events that's taking place this year to mark the 25 years of the Alliance for Health Policy and Systems Research. My name is Aku Kwame, and I'm a technical officer with the Alliance. And I'm delighted to be moderating this session today. The session is going to take a look at country-level perspectives on institutionalizing the generation and use of evidence as a form of institution building. And as I said, we're having this event today on the sidelines of a very important meeting that's gathered institutions, training and research and policy institutions from all over the world, from Nigeria and Trinidad and Tobago, from Cambodia and Indonesia, from Georgia, and oh goodness, what's the last country? From the United Arab Emirates as well. And this work has taken place over the last 3 years and has been conducted really under the leadership of colleagues from the Knowledge to Policy Center here at K2P. We're delighted for having our hosts here today. Now, in order to have this event, let me just very briefly share what the outline will be. We'll start with some welcoming remarks. And then we will take a look at the evolution and development of the field of health policy and systems research here at AUB and more broadly in the region. We'll also take a look at the Alliance, past, present, and future, and we'll discuss a little bit about, in terms of institution building and generation of knowledge, what does that look like for the field going forward? And then we're delighted to have an esteemed panel of speakers who will be speaking to some of these issues in their own countries. I also want to welcome those of you who have joined us online and to let you know that we will be having time for questions and answers. And I will ask you to please put your questions or your comments in the chat, and we will reflect those as well. And I think while we're waiting for the technology to work, I can go ahead and invite up Professor Fadi El-Jardali, who is the director of the Knowledge to Policy Center here in Beirut, for his welcoming remarks. Fadi, please.
Thank you, Aku. Welcome. Good afternoon. Muted? Are we muted? No. No, I mean the online. Are they able to hear us? Because here it shows that we're muted. Okay. مش الحال. Good afternoon. Welcome. Thank you so much. It's always great to see you all here, and welcome to Beirut. I would also want to welcome the people who join us also virtually. This is to welcome you to the Beirut edition of the Alliance Public Events on the Evolution of Health Policy and Systems Research, about reflections and new horizons. We're so happy that the Alliance for Health Policy System Research, under the new leadership, that is actually working on getting insights about the new strategies and priorities for the Alliance moving forward. We are delighted to be hosting this hybrid event in a region where strengthening and advancing health policy and system research is much needed. And for the institution like HPSR, which has played an instrumental role in paving the path for better policies in the region. The EUB Beirut event is served in a series of global events coinciding with the 25th anniversary of the Alliance for Health Policy and System Research at the World Health Organization. As a continuation of the conversation that initiated in London and Oslo, the Beirut event will reflect on 25 years of health policy and systems research, with an opportunity to engage with institutions in the EMR that are involved in health policy and system research, and policy makers to shape future opportunities for this region and beyond, to advance the production and the use of health policy and system research at the national level, regional, and global level. We look forward for a rich, insightful discussions with our esteemed speakers, panelists, and the audience. Thank you.
Buddy, thank you very much for those words of welcome. I'd now like to invite Dr. Kumanan Rasanathan, the Executive Director of the Alliance, to also give his welcoming remarks. Kumanan, please.
Masat al-Khair, and good afternoon, everyone. And it's my great pleasure to be here at this storied institution with such a long history of advancing knowledge and translating that into policy improvements and better outcomes for people. So we couldn't have a better venue. So thank you so much, Professor Abla, Professor El-Jadali, for hosting us. We're very grateful. And Fadi, you have articulated already what we are doing here today. So I don't need to add much, just to say that we're so delighted that we can continue to celebrate our 25th anniversary for the Alliance for Health Policy and Systems Research here today, following discussions over the last couple of months in London and in Oslo, and we will continue to do this throughout this year. We are here at the sidelines for a very important meeting for us that is being hosted by the K2P Center, and a program that has been led by the K2P Center, and then delighted to be joined by colleagues from around the world, from all WHO regions, from 6 other countries. So it really is great to then be able to do this event here today, and we will gain so much from your insights as we plot the next 25 years of the Alliance. Just finally to say 2 things. I only started as the executive director on the 1st of November, and the program we are discussing today was very much the vision of the previous executive director, Dr. Abdul Ghaffar, who has deep links to this region. And so I'm very grateful personally for his vision and for what he has left me in terms of leading the Alliance team. And then secondly, we have a new chair of our board of the Alliance, following excellent leadership by Professor David Peters. But from January 1st, our new board chair is the Right Honourable Helen Clark, former Prime Minister of New Zealand and former administrator of UNDP. And we're pleased that she could not be here in person, but that she can share some remarks over video. So Aku, if you could now play the video so that Helen can share her good wishes and insights for this event today. Thank you.
Clearly, the world is not what it was when the Alliance began around 25 years ago. We are in a syndemic of connected crises, and they are battering health and well-being, and they're battering health systems. So we need to look beyond health systems to understand what are these drivers of the challenges we face, and then look at how health systems can contribute to interacting with those working to solve a range of issues, whether it's how to deal with health emergencies, whether it's climate change, how to make our health systems more resilient to pandemics and other adverse events, how to deal with the changing demography, how to deal with the declining trust in authorities and science, which can be so detrimental to how health systems function. So there's a whole new agenda out there that's driven by the context of the times in which we live. And I really look forward to seeing the Alliance step up to address the factors and issues that this is putting before us.
Over to you, Hakeem.
Thank you both, Fadi and Kumanan, for those welcoming remarks. Given the fact that we are looking at the evolutions of health policy and systems research, what better way to do that than to look at those evolutions within the region and specifically understand how AUB has been integral into that. And to do that, we will invite Professor El-Jardali to give a presentation on the evolution of HPSR at AUB. So Fadi, please.
Thank you, Aku, and I will go so fast with this because I know we don't have time. But I have to say that in our institution, the work in health management, health services administration, health policy has been taken, place since we had the Faculty of Health Sciences. So I'm not going to go back to discuss all this, but I wanted to actually start from the first study that we got funded from the Alliance for Health Policy and System Research and IDRC, because this is how we started actually working more systematically on health policy and systems research. Okay. So before we talk about what we have done, it would be important to actually more reinforce that health policy and systems research focuses on policies, organizations, and program from a system-wide perspective, but not on a clinical or basic research. So basically, this type of research focus on many dimensions of health system and taxonomies when it comes to health financing, human resources for health, governance in healthcare, implementations, and others. Health policy system research has the potential to provide evidence, and we have seen that in many countries in the region and beyond when it comes to strengthening health systems and improving health outcomes. One of the aims of health policy and system research is to bridge the gap between research producers and research users and consumers. That's why we always work on the demand side, as well as we work on the supply side to make sure that the research that's coming is really policy relevant, but also informing and shaping policies and programs in Lebanon and the region. So when it comes to some of the initiatives that we at the Department of Health Management and Policy and Faculty of Health Sciences that we have engaged in over the last, I would say, 10 to 15 years. This is a study that we started, and I was happy to see Dr. Nabil Rumful, because if you recall that study that we have done in the 9-country study, and it was the first study, in fact, that elicited the opinion and perspective of policymakers and researchers about health policy and system research and the use of evidence in policy. This is a study at that time that was funded by the Alliance for Health Policy System Research, matched with IDRC, and also through the MENA Health Policy Forum when we actually started that at the board. So I just wanted to, so this is how we actually started, at least during this time, to work with the Alliance on this work. Again, then we continued, and we have done 14-country study where we reach out to more than 250 policymakers, stakeholders, senior politicians, director general, and others to elicit and actually understand more about the gaps, the need that they have when it comes to making decisions in ministries of health and beyond. We assess also the perspective of researchers, and this is where we already started to understand that, in fact, we have more of the lots of needs, a lot of policy relevant priorities, but not a lot of, so the demand is there, but the supply was not there. So the question is really how we can synchronize that. So we've done studies to take stock of what has been produced since year 2000. It was for 8 years, and we started from that. We look at to what extent the region has been producing systematic reviews in health policy system research when it comes to health financing, when it comes to delivery science, when it comes to governance. So we all documented that just to tell a story. There is a mismatch between what are the priorities, what are the needs that are really out there, and versus how much we are producing real-time policy relevant research in order to inform decision making. It's taking time to move the slides. So this is, again, the work that we have done in 14 countries where we actually reach out to policymakers and researchers. Also, we've worked on assessing the practices of many universities in the region, and this is in collaboration with WHO AMRO, and I'm sure that Arash will actually share with us more about the great work that AMRO is doing as well when it comes to promoting the use of evidence in policy. We created the Nodal Institute. We were the secretariat for the Nodal Institute, and this was actually to create hubs in the region for health policy and system research. We are now working with many colleagues, like in Jordan, like in Tunisia, like in Morocco, like in other countries, and this was part of the work that we have done here at UB, also supported by the Alliance of Health Policy and Systems Research. We started working on understanding to what extent health policy and system research is funded, and I'm sure you realize that it's still underfunded despite the many priorities that we already have. We also started producing health policy analysis, so we would start doing health policy analysis on different priority areas, why policies failed, why they succeed, what needs to be done. And we were actually trying to generate more evidence in terms of this. All this was actually, again, I have to give the credit as well to the Alliance for the support that was provided. Of course, briefly before I finish, what we have found when it comes to the production, certainly that we have seen an increase in the production of health policy and system research, and started to peak after 2005. So this is still, we are low when it comes in terms of numbers and quantity and output in comparison to other regions. Most identified articles focus on delivery arrangement and implementation strategy, but less on financing, less on governance. Misalignment between the research priorities and the actual research production, and gaps in the production of systematic reviews in health policy and systems research. When it comes to the use, of course, we realize that, in fact, knowledge translation was absent in the sense of how we are taking evidence to inform policy, low capacities to translate evidence to influence policy decision, limited appreciation and low demand for the use of health policy and systems research, weak communication and exchange, lack of administrative structure. I'm happy to see, in fact, in many ministries now in the region, we started to see health policy analysis unit, we're seeing knowledge translation unit, we're seeing observatories, and this is really more to create the structures, processes, incentives in order to generate policy relevant evidence, use existing data, harness existing system in order to inform decisions in real time. And we've learned the hard lesson from COVID-19, I have to say. In terms of the training program, only a small number of health policy system researchers in the region. We still actually have limited number of faculty members and researchers in health policy and systems research working in different institutions in the region. A limited number of universities have standalone health policy and systems research program, and very few NGOs, think tanks, and other independent institutes focus on health policy system research. That's what we found at that time. In terms of the health policy analysis, we found limited capacities to conduct health policy analysis, evidence not commonly used systematically to guide policy development and implementation. The factors influencing policymaking were mostly political interest, sectarianism, urgency, and values of policymakers. I'm not saying that this had changed, but the question is, to what extent, despite that many decisions in the health space is political, the question is to what extent evidence is used systematically among other factors that come to play when decisions are being made. Barriers to the use of evidence were lack of policy-relevant research evidence, political context, personal interest. In terms of funding for health policy and system research, we get challenged until now still to actually attract funding to conduct health policy and systems research. None of the 22 EMR countries that I've studied had explicit national funding or budget line for health policy. Till now, we don't have explicit funding budget line for health policy and systems research, despite all the priorities and the crises and the challenges we have. Most notable sources was external international grant, followed again by academia. When we zoom into Lebanon, before I finish, this is also when I refer to the work that has been done by the Alliance. If you can go to the next slide. And this is actually one of a global report that was done, and this is the first Alliance-funded report of its kind. And we've seen and we've surveyed many institutions, think tanks, NGOs, and universities in Lebanon to see to what extent health policy and system research has informed policy decisions. Certainly, the growing influence is driven by political will to address critical health issues, greater appreciation among health policymakers of the value of research. We've seen a change in the way we look at evidence and to engage with evidence production and the use of evidence, but still health policy and system research is not institutionalized in the way we make decisions about health. It's not yet part of the institution. It's not part institutionalized, and this is one of the things that we are really want to actually work more and more in this. I'm not going to go into this, but you can see, unfortunately, how much we're spending at the institution level when it comes to health policy and system research. The number of meetings, of course, it has been increasing over time, but still we are really lagging behind when it comes to investment in this type of research, but more importantly, investment in the generation of policy relevant research, but also in the use of this type of evidence to inform decisions at different levels. Again, what is being done to address the challenges and gaps? And then this is one of the things that we wanted to mention. We go to the next slide, please. I want to mention that EUB, the Faculty of Health Sciences, actually, along with the Mohammed bin Rashid School of Government, and thank you, Dr. Raetz, for being with us. You're the dean of this school. We were so delighted with that collaboration that we have done for hosting the Global Health System Research Symposium 2020. I want to thank also George, because you were actually the director of the Secretariat of the Health System Global. And you know how much work we put into that, all of us. We were challenged by COVID-19, but it was pulled together at the end. But I wanted to mention that this was a success for the region, I have to say, because this is the first time the region was hosting Global Symposium Health Policy and Research. And it's the first time that the region had a say in actually the theme and the sub-themes and designing and organizing this symposium. So I just wanted to actually, there was a lot of work that has been done, and we were so happy that this was actually successful. Next slide. Again, we have now the Health System Global Society regional network. We participate in the board, and now we are engaging with many countries in the region. So there is a hub, regional hub for the Health System Global Society. We're seeing more membership from the region in SDG and health system. We still want more, but I was happy to see in Bogota, when we're in Colombia, more and more people coming from the region. We established, the Faculty of Health Sciences established the K2P Center, Knowledge to Policy Center at EUB, and we are delighted that this is for the third time we are designated as a WHO Coordinating Center for Evidence-Informed Policy and Practice. As you know, globally, there's 2 centers in this designation, one at McMaster University, the McMaster Forum, and the second one is the K2P Center. I'm not going to go into a product. I think I'm out of time. And I just wanted to actually mention that, and I'll leave it for Dr. Arash. I know that in the panel you will discuss, there's a lot of interesting work happening in AMRO. I will not talk about it, but there is the Net2P that is really quite interesting, a platform and network and engagement that is really happening at different level when it comes to the use of evidence in terms of knowledge translation engagement of countries. But so happy and delighted to see this also happening also at AMRO level, at the country level. And I just wanted to, this is my last slide in terms of what we have learned in terms of implications. Certainly, we still need to invest and strengthening capacities at the individual level, at the institution level, and we need to rethink the incentive structures. Now, we here at EUB and some other university, we're starting to see not only look at the quantity of production of research when it comes to reviewing promotion files, we're now looking at the value of research. To what extent this research had actually been informing, shaping, influencing certain decisions, to what extent has been used in terms of, so I'm happy to see that it's starting to change. The value of research is very critical at all levels, not only health policy and system research. That's why we need to create different incentive structures to support the production and the uptake and the use of health policy and system research in decision-making at different levels, align health policy system production with policy priorities and country needs, invest in postgraduate teaching in academia, and establish more entities dedicated in health policy system research production translation. In Faculty of Health Sciences, now in the MPH program, we have a course that actually also integrate knowledge translation. So now our students know how to actually communicate evidence, how to look at systematic reviews, how to write policy brief, how to engage in policy dialogue. I think this is very important, and how to actually develop advocacy strategies in order to influence decision, advocate for dedicated domestic and government funding, which unfortunately, I'm not talking about government in Lebanon, but because it's absent, but I'm talking in general in the region, we still have a major problem in actually having explicit funding for this type of research, and expand pool of knowledge relevant for policymaking through multi-sectoral collaboration within and beyond health sector. And this is what Helen Clark was saying, that we look at the health system and beyond. And we've learned also the hard lesson from COVID-19 when it comes to how the different sectors are working together in order to strengthen and protect the health of the people through having a effective public health infrastructure in the countries. This is not only for the Ministry of Health, this is for different sectors coming together. And we want to institutionalize the use of health policy and system research in decision-making processes. Thank you.
Fadi, thank you so much for that rich history. I know it's very difficult to distill 25 years into just a few minutes, but you've done so brilliantly, and really important issues that you have raised, and we'll discuss them further. I'm now delighted to introduce our next speaker. We've invited reflections from another global leader in health policy and systems research. Dr. George Godzache is the director of Curatio International Foundation, which is based in Georgia. And we asked him to give his reflections in terms of the Alliance's 25 years as a partner. Curatio has also celebrated recently its 25 years, but George's engagements with the Alliance have been both as a grantee, but also in his directorship of Health Systems Global. So George, over to you.
Thank you, Aku, and dear colleagues, good afternoon. So it's a great pleasure to be here in Beirut at this very important moment for the K2P-led project, in which we partnered as an organization, as well as celebrating 25th anniversary for the Alliance for Health Policy and Systems Research. So I think I could go back in 99, and since over the course of these 25 years, I've personally known all 4 executive directors and had a pleasure to work with them as a collaborating partner and leading the institution from Georgia, as well as the colleague with whom we have jointly built different programmatic initiatives supported by Alliance. And I remember numerous of those that were led by Sarah Bennett way back in 2005 and 2006 on different fronts, where Alliance was still young, but on one hand working on these critical outputs. I remember the report Systems Thinking for Health Systems, as well as working on very important initiatives. At that time, we were talking about the future generation of the researchers that would lead the front line of evidence to policy link and HPSR. And that future generation now is grooming the next generation in this field. And I'm glad to be that we're part of that. So I think personally, Alliance has done a lot, and I'll try to reflect on a couple, considering the time limitations that we have. The first, I think I've just mentioned one landmark report that the Alliance has produced, but by far this is not the only one. And luckily, we have benefited as a society, as a field of health policy and systems research. We have benefited of numerous very important methodological documents, guidance documents that young researchers in our institutions and around the world are actively using them and building the field and contributing to the field. As I've said, there was a huge investment also beyond the methodological and field support, so a huge investment in capacity building. And the initiatives there are numerous, and I had a pleasure to be part of some in old days, but most recently also we have jointly picked up with Alliance when I was leading Health Systems Global from 2015 to 2020. So the first time women authors in the health policy and systems research. And that was one of our favorite investment in future generation researchers, and especially maintaining and achieving better gender balance and supporting the female authors to publish in well-recognized international journals. I also, as an individual, also would like to thank the Alliance for starting the society of those individuals involved in health policy and systems research. This society was first started way back in 2010 in Montreux, when Alliance organized the first global symposium on health systems research, which then was followed in 2012, the establishment of the professional society called Health Systems Global. And since Health Systems Global has become the host institution for global events that takes place biennially, every second year, and rotates, and the last one, the previous to the last in 2020, excuse me, was planned for the Dubai, for the region, thanks to colleagues from Bin Rashid School of Governance, as well as through the leadership of Dr. Fadi Al-Jadali, so who have pretty much inspired and brought this event to the region, and not only brought it, but also invested heavily throughout 2 years preparing it, but then COVID failed all of us, but luckily we managed to transform it into a virtual event and still deliver to the society is important. The role the Alliance has played throughout, building this activism, building and supporting the individuals, young researchers participating, securing funding so we could provide the scholarship and support to young researchers, those whose publications have been accepted to be presented in the symposium, is enormous. And as a result, the impact of Alliance is important and enormous on the field, advancing it methodologically as well as globally beyond the boundaries of limited number of northern countries that usually inspired or initiated such research, but also helping us in the institutions in the south and north alike. So to grow together, to build the partnership bridges through which and across which we're working quite frequently and enjoying being colleagues, enjoying being friends, but most importantly, enjoying being able to contribute to the field that helps our societies, our nations, build more robust and resilient health systems for the benefit of our children and our future generations. And on that note, please join me applauding the Alliance and thanking them for all the investments they have done.
And please join me for appreciating George for his comments. Thank you, George. And so with that, we want to invite the Executive Director, Dr. Kumanen, to give his reflections on past, present, and future of the Alliance. Kumanen.
So, I mean, you've already heard a lot from George and Fadi. So, but maybe for me, it's worth reflecting that the Alliance has achieved a lot. But when we say that the Alliance has achieved a lot, it's not just a small secretariat sitting in Geneva who work very hard. And again, I really take no credit for that, having arrived only a few months ago. But as George said, to 3 previous leaders of the Alliance and a small number of hardworking professionals in the Secretariat. But really, the Alliance's achievements are this broader community. So one of the major achievements of the Alliance is that there is now a global community of people who are working on health policy and systems research all around the world. So if you look at our new annual report for 2022 that has just come out, you'll see that the Alliance last year supported people working in papers in 85 countries. So that is an achievement, but it's an achievement of institutions like the K2P and AUB, the people who are leading, like George at Curatio, like all of the colleagues we have here from 7 countries who have charted new waters in this field and shown that it can make a difference to health and health equity. And I think that is a tremendous achievement. I think the second thing that we've heard is that the Alliance has helped to build a field in terms of methods, in terms of ideas that have been launched into the world and have enabled people to exchange, to train. But then again, the real achievement is the institutions in countries who've taken that knowledge, built upon that knowledge, and trained countless numbers of researchers, of policymakers who understand how to generate health policy and systems research, how to use health policy and systems research, and have helped to build institutions. The Alliance can point to particular policy impact from some of that work, and we heard great examples today. But again, the achievement there is of policymakers and researchers in country. And the Alliance has a number of important partnerships. Foremost, a society now, Health Systems Global, which George knows very well, had made it work for many years, but a number of people in the room have been on the board, including Fadi and Aku. And so that is an important relationship. The Alliance is based at WHO. So and we have Arash here, we have other colleagues. So it's been able to work with throughout the regions of WHO with country offices of WHO to support that work of translating and generating knowledge that can be used for impact on health and health equity. And the Alliance has also worked with other partners. So I'm not sure if Chow has made it yet, or he's there. So UNICEF, where I used to work, and that's where I first really engaged with the Alliance, working in a partnership starting almost 10 years ago. And that those partnerships continue with many other UN institutions, with other agencies such as Gavi or the World Bank. So the Alliance, I think, can be proud of the achievements in building the field and its methods, building a community, and having partnerships at global, regional, and national levels that allow the generation, the use, and the application of health policy and systems research. So those are achievements to be proud of. But moving forward in the next 25 years, which is what we will discuss for the rest of the session, what should the Alliance achieve? Once you get to 25 from a UN conception, you're no longer a young person, which is great, but it means you cannot just trade on potential. People want to know, what have you actually achieved? And so I think the Alliance going forward is not to be satisfied with its current ambitions, and that's the Alliance writ large, not just the Secretariat, but all of the institutions, the community that constitutes the community of people working on health policy and systems research, to have more impact, to be able to reach out to new fields, which is what we're seeing. So yes, we should continue to do work on health financing or health workforce or service delivery, but we should also continue these new challenges. We talk a lot about these multiple linked crises, which perhaps sitting here in Beirut, we feel very acutely. So what is the contribution of policy and systems research to addressing the potential and the challenges of artificial intelligence, or of aging societies, or the climate emergency? These are things that I feel and believe that policy and systems research as a method has something to contribute to. To conclude, I think in PubMed, there are 35 million indexed articles. Half of those articles have been produced since 2009. And currently, we produce globally about 1.5 million articles into PubMed. Are we getting the policy impact, the improvements in people's lives, the improvements in health equity from all of their effort? And a very small proportion of their effort is on health policy and systems research. There'll probably be people in this room or online that don't completely know what we mean by health policy and systems research. So our challenge then is to get more impact, to really see who are we trying to serve. It's people affected by these crises on health policy and systems research, and really feel that we can contribute to both managing the crises of the today, but also preventing the crises of tomorrow and getting the world back onto achieving the Sustainable Development Goals by 2030. Thank you.
Thank you so much to all of our speakers for giving us really thoughtful reflections to frame the conversation. We had set aside some time for Q&A, but we will hold those questions. For those of you who are online, we will ask you just to please do put your questions in the chat box. We are monitoring that, and we will hold them for after the next session. And now I'd like to invite our esteemed panelists to really speak to us. As Kumanin said, we're going to now look into the future. when we speak about evidence generation and use for institution strengthening and how that can help sustain national health gains, we have a panel today that we are going to ask those very questions. So I'd like to invite each of them up in turn. I'll start with Dr. Arash Rashidian, who is the Director of Science, Information and Dissemination at the WHO Regional Office for the Eastern Mediterranean region. Next, I'd like to welcome Professor Hoda Rashad, who is the Director of the Social Research Center based at the American University in Cairo and has played a major leadership role in the development and engagement and continuity of the social determinants for health movement and field. And then thirdly, I'd like to invite Sita Devi, who is based at the Universitas Gadjah Mada and who heads the Center for Health Policy and Management. So all three of you, please, you're welcome. Come this way. I think it's okay like this. We know who's who. So thank you very much. Wonderful. So, I will not sit. I will stand on duty and pose you some questions. We've asked you to think a little bit, but I would like to start with one round of questions and then perhaps maybe reflect on what you say, and then we will open it up for questions and comments. So Dr. Arash, I'd like to begin with you, if you don't mind. We know that in 2019, that the Regional Committee of the WHO Regional Office for the Eastern Mediterranean adopted a resolution on specifically developing national institutional capacities for evidence-informed decision-making for health. And so if you could share with us briefly on how that experience has been, how is EMRO working with countries to address their most pressing needs? So please, Dr. Arash, over to you. It's underneath, yes, that very button.
Okay,
yes.
Many thanks. Thank you, Aku. That's a pleasure to be here. I'm very grateful for the invitation from the Alliance and also from the K2P. As I mentioned this morning in our internal meeting, so for me, Beirut is like home, and I really love to be with colleagues. Another introduction I want to mention, I'm really glad that also WHO representative in Lebanon is also with us. So the Dr. Abdi Nasser Abu Bakr is also here. So that's excellent. I mean, sort of for the program that is happening. So going to that agenda. So I mean, many thanks for highlighting that. I mean, in the regional committee in 2019, the decision was adopted with a strong support from ministers of health of the region, not to support evidence-informed policymaking, because that was already there in WHO decisions in the past globally and also at the regional level, but actually to give the task to WHO to work with for institutional capacity for institutions in the countries, not about the sort of making sure the best evidence is available, making sure the institutions are capable of doing that. And I'd like to also refer to just a bit, with your permission, of how that decision came about. So, I mean, within WHO, whether this is a priority for action for WHO then, I mean, now it's very different. Everybody agrees with that. It was not that easy. I remember we had a lot of discussion in the regional office whether this is a priority for action. So then after a lot of contemplation, regional director agreed that we would have a short presentation in 2017 in another regional committee, just to raise the issue with the ministers, how they feel. And then the reaction was totally positive. I recall in that presentation, I gave a similar figure like what Kumanan gave us today. So the proportion of research on health policy and the numbers from the region and also the actions. And then everybody said, no, we have to act on it. So then the WHO started on the program. Again, another key event happened in Beirut. In February 2019, we had a major discussion with member states and key institutions in Beirut, discussing the idea of a sort of integrated multi-concept approach for evidence-informed policymaking. And the same concept was presented in October for decision-making. So and then we know what happened after October 2019. Then COVID came early 2020. So there was a program that came forward for that institutional capacity making. There were certain elements into that were quite innovative, and that I give that credit to the ministries of health of the region. So bringing the issue of not only the evidence-informed policymaking in terms of the traditional knowledge to policy processes, but also highlighting the importance of linking with other programs, linking with the guideline program, linking with the HTA program, Health Technology Assessment Program, highlighting much further the role of national data, like the examples we heard from birth countries this morning. So the local data, national data, and then bringing all of them together under one umbrella. And that's what we have been trying to do in the region. So as I said, COVID came. The result of that was, Dr. Abu Nasser is now our WR for Lebanon, but during the COVID, he was the head of the IMST for the region, so heading the COVID response. And within the region, we had an innovative decision, which was having a pillar for research and knowledge management. Within that pillar, several functions are done. One of them was actually looking at countries, how they use evidence for policymaking. And then 15 case studies were conducted within 13 countries of the region, including very low income countries and very high income countries of the region. And the examples were quite varied, but what they really highlighted, and that goes back to your question, Aku, is that for a lot of approaches that we take for use of evidence for decision-making, there are important research questions still remaining. So the difference between health policies, and I'm coming with a health policy research background, so it's been my life since I became a professional. So the difference is, so let's say if I'm going to make a policy recommendations for how to, to convince the policymakers that, make it a very simple question, that we need to reduce the amount of salt in food. Definitely, I'm not going to start a new research for that because already established the SALT process. There are many other questions. So it's not always about doing a new research. The point is actually make sure that what we already know is answered. What we usually don't know within that process, and the question remains, is that what are the most effective ways of doing that? How to make sure in different contexts. So one challenge in health policy and system research is quite context specific. A solution that works in one country may not work in another country. A solution works today may not work in 10 years' time. And these are the areas that we really need to work on those further. So maybe I stop here, and I would sort of put this as an intro to the main area I think we should work further. With with the alliance to try to mobilize resources for answering those questions for policymakers and policymaking processes. Thank you.
Thank you very much, Dr. Arash. A lot there that we can pick up on. Prof. Hoda, I wonder if I might come to you next, and if you would share with us some of your experience of generating and using evidence, but particularly to build institutions, to strengthen institutions. What is needed in terms of when we think about capacities? What is needed in terms of the new forms and old forms of evidence, and what evidence do we need for strengthening future health systems?
Well, thank you very much. The question was, what country needs in order to engage in health promotion and in sustaining health gains? And before addressing this, I think I find a great deal of difficulty to engage in a discussion like this, where we see around us in the region, people and states are suffering and they're struggling to survive. So in a way, realities on the ground are overtaxing and even breaking many health systems. So in that respect, I would like to endorse what Helen said at the beginning, in that before starting to talk about health systems, we need to go beyond health system and then move into the needs of the health system itself. To encourage a discussion like that, I'll just quote a number of statements and will not dwell on them and leave it to the discussion. The first is that the AMRO Commission on Social Determinants of Health, one of the statements they made was to countries was do something, do more, do better. So the range of things you could do in country is very diverse. And in our region, customizing and contextualizing and understanding this diversity is extremely important. I cannot talk about country needs in general. But the second statement that I'm really think about a lot, it's about social vaccines and about social resilience. Our colleague friend Broom from the Commission did introduce and use the concept of social vaccine. So instead of looking at the potencies of vaccines, let's look at the potencies of social policies. Our colleague here, Hoda Zurek, was using social resilience when you were talking about Lebanon, when it faced the war and the crisis and so on. Those are concepts and statements that we must think about prior to getting into the nitty-gritty of the health system policies and health system research. The last statement in this respect, the cover of the report of the AMRO Social Determinants of Health Commission was Building Back Fairer. And whenever I look at this title, I'm reminded by an intervention by Professor Iman Nouehed. I'm happy that you are in the, sitting here, because your intervention during the commission is that when we say building back fairer, it gives the impression that it was fair before and we're building back fairer. And I think the fact that it wasn't fair is the reason we are getting into this discussion of crisis and so on. So that's my first point. My second point, in terms of needs, it's very clear that we need to nurture and support champions. We don't have champion, quote unquote. We have points of strength. And there is a lot of investment and a lot of work, a lot of perseverance that is needed for these points of strength to become champion and to become a movement in the region. My last point, which I think that it's the key message, it's about changing mindsets. The statement of changing mindsets was the title of a Health Policy Alliance, Health Policy and System Research, and it talked about changing mindsets. But what that excellent report was about, it was about breaking the silos between the research community and the policy world. It was emphasizing the idea of demand-driven research. My point is different when I say changing mindsets. I would like to revisit the demand, because demand-driven research does not always pose the question that we need to pose in order to promote health and to achieve health equity. So really we are after a mindset that appreciates the evolution of the health paradigm, a mindset that understands the convergence of both the development and the health field, a mindset that redefines the role and the mandate of the health system, a mindset that appreciates the difference between social framing of health and social framing of health equity. It is that mindset that we need to work on in order to agree together on a demand that is of interest to the decision maker and of interest to the research world. My last comment here is that I feel there is an opportunity on the ground. If you look currently to the strategies of health system, the recent strategies, if you read the recent strategies, they are beautiful strategies. they talk about equity, they talk about intersectoral, they talk about social determinants. I mean, they could not have been written better. But the disconnect between this strategy, and I always wonder who wrote the strategies, because the disconnect of the strategy and of the action proposed to meet the strategies, it's just a wide gap. And the minute the health system, the health policy appreciates the disconnect and are willing to work on this disconnect, then we will have the demand-driven research that can bring us all together. Thank you very much.
Thank you very much, Prof. Hoda. So then, Sita, let me come to you. We've heard so much, and we will open it up to the audience in just a moment. But Sita, we'd like to hear from Indonesia and the region more broadly. We know that, of course, in Indonesia, you have a longstanding experience and history with using knowledge in developing national development. And yet we know that Indonesia is also very diverse locally. You have 38 provinces and 514 districts. So in order to have that connect between the local and the national and using evidence, what type of evidence systems are needed? Can you speak to us a little bit about your broader reflections as well, please?
Thank you, Aku. I think for the context of a country that is as big as Indonesia, I can reflect on the alliance itself. I think the cumulative knowledge within the alliance society is, very rich, abundant. And it's just a matter of knowing what kind of knowledge that we can access and can implement in a certain context that needed that particular knowledge or the particular skills. I think it's the same with Indonesia, with countries as big as Indonesia. As you mentioned, we have policies at national level. We also have policies at local level, and we have so much diversity in the local government capacity and resources availability and context. And so each of these districts, each of these local government needs different kind of knowledge, needs different kind of skills that can support them, that can help them in, making their health system, the local health system, works for them. And Indonesia has a huge amount of knowledge accumulated as well at these HPSR institutions across Indonesia. We have so many HPSRs, but again, access to these HPSRs are not always available. Professor mentioned about the need to breaking the silos, making sure that it's demand-driven policies, research. It is also the same in Indonesia. I think local government needs to have a particular priorities, needs that could be expressed and conveyed to HPSRs. And on the other side, the HPSRs needs to be responding and needs to be aware and sensitive to these needs. This kind of dialogue needs to happen. This kind of platform needs to be available and accessible to all these HPSRs. So what we're trying to do in Indonesia is we try to build a network of HPSRs. I think safe to say that we at the Universitas Gadjah Mada, we cannot do everything by ourselves. We do need other HPSRs. We do need to make that kind of networks of HPSRs. We do need a network of other players, other actors in the health policy and system ecosystem. So we need them all in order for us to, flourish, in order for us to be beneficial to the policymakers. So we need that kind of environment. And so what we do is we build this network of HPSRs. We build this network of university-based research institution. We build network with NGOs who are also doing research in health system or in health policies. We also engage with the beneficiary itself, not just the communities, but the policymakers. We build networks with them. We build a platform that enable the dialogue happen. And this is something that we need to heavily invest in, not just to making sure that the network exists, but also the capacity, the institutional capacity of this HIPS3 within this network is also built, because there's a lot of potential out there, but there's, it's just knowing which tool that we can use to harvest this potential from the HIPS3s that exist in Indonesia. Thank you.
Thank you very much, Sita. Wonderful. So let me just reflect back a little of what we've heard, and then we're going to invite some engagement from you, the audience. So if there are questions online, we can monitor and see if there are some coming available. And those of you who are sitting here in the room can raise your hands, and we have someone with a microphone who will come to you. But from Dr. Arash and Prof. Hodan from CITA, what we've heard is that when it comes to generating evidence, it's not only that we need to always generate new evidence. Sometimes it's about refining the question. It's about trying to understand what are the best ways to implement and learn as we are engaging with policies and trying to improve practices, but that requires going beyond health, that sometimes we default by starting within the health system, but many of the issues are beyond the health system. And it's not that we need to think only future thinking, but there's a lot of unfinished business in terms of how we understand the realities of equity on ground. And so really, how do we change mindsets, not just structurally and administratively and between researchers and policymakers or between levels of the health system, what is required, particularly when in country there's so much diversity. So it's not just the challenge of cross-country comparisons, but how do we learn between localities and the resources and capacities and time and investments that are needed across localities to be able to use local evidence, while also networking across different types of institutions and building dialogue to support an overall ecosystem for health policy and systems research. So a lot within all of those comments. And I wonder whether there are any reactions, reflections, experiences, or questions to be asked. Let me first start by the online chat. Do we have any questions there? Samar.
Okay, we have one question. How is the impact of health policy and systems research measured? Is there an analytical framework that we can use?
Wonderful. So the question is how is health policy and systems research measured? This is a loaded question, and I'm sure that our panelists will have some views on that. So maybe we'll take a round of questions, and if there's anyone in the room who would like to ask something. Yes, please, sir. There's a microphone coming to you. You're still welcome, please.
Good afternoon, everyone. I think I would need, I think I would like to start by saying how really impressed I have been by all the work that has been done by Dr. Fadi and by AUB and the comments. I think, what? Lala, okay, my name is Nabil Kronful. That's okay. It's not difficult. The first time I did write a paper on health systems was with it was at EMRO with Dr. Bishop. I don't think many of you know him because I'm the veteran. You see, the problem is that we are in this part of the world, basically the provider, as Dr. Huda mentioned, they do not feel that this is something that is important for their work. They do not believe that information, that correct papers, data is something that is part of their work. This is far more so the work in our community of the universities, of the papers, of the research. So there is the link, as you said, there is a disjunction between the policymakers and the producers of research. Unlike research in the biomedical centers, where you can do research in clinical work or in certain diseases. In community, you really need all the people to be involved and to appreciate the value of the information. Besides, it doesn't take one person. It takes a whole community of people who are in various departments, in various universities, in a consortium of insurance. Health policy is health. It's not a condition, let's say, in gastroenterology or in cardiology. It encompasses all the aspects of health. This is not a critique of the excellent work that has been done, but there is a problem when it comes to public health research or health systems research, or you really need the input of all the partners involved. But this is, of course, I wish an excellent continuation of this. The papers that were produced were very valuable. Fadi has done his superb work. The question is that how do we break into the policymakers? And I think at the regional committee, more and more of the involvement of the ministries, of the people in the ministries, etc. Thank you very much. I'm sorry I took this time.
Not at all, sir. It was wonderful to have your reflections. Thank you. I believe there's a question at the back.
Good afternoon. Thank you very much for the panelists and for the K2P Center for all their wonderful work that they're doing. As I was hearing the presentations, I was wondering to myself, and I was interested to hear a little bit about the commercial determinants of health and how do they find themselves into this wonderful work that's being done at the systems level, whether it be research or it be advocacy, or is it to or at the level of knowledge translation. And we know that commercial determinants of health has now been a major field of study, expanded on the social determinants of health model, right? And the Director General himself in a recent Lancet series commission spoke about the importance of addressing and turning attention to the commercial determinants of health rather than just the social determinants of health, which play out on providing a system that supports the industry and the work that they do to compromise health. And then the WHO is going to come up with a 2024 report on the commercial determinants of health. Now, given now that the global world is now a global health system and a global system where major actors have a very important role in research, infiltrating research and affecting public health, I was wondering if the panelists could say a few words on how they think health systems can situate themselves vis-a-vis the interference of the industry in every aspect of human life as we know it in our planet. And this is very important because this is important for our students to learn about and to hear, because this is a very interesting and relevant and global topic. And I was wondering, I was hoping to hear something about that, and maybe it's in the agenda but I haven't heard, and I would like to ask this question. Thank you very much.
Thank you very much. So we have two clear questions for the panel. And just to share with you that, one more question, just to share with you that the commercial determinants of health is an area that the Alliance is supporting more health policy and systems research on that. We were parts of the Lancet series that just came out, but I will let the panel respond to that. Sir, your question, please.
Hello, everyone. So one last question. My name is Wadi, and I'm a health economist. I'm also studying global health policy. So my question is around the importance of supporting research in countries who are going through crises like Lebanon. So countries who are going through crisis, usually they have much more experiments. It's very turbulent. The decision makers are usually very open to new ideas. And there's also one important aspect to be investigated, which Professor Huda also mentioned, the gap between the strategy and the implementation. So there's a lot of work that could be done around the political analysis for health policy. So how to actually drive change and bridge the gap between strategy and implementation. So my question is how we can help and foster this research in a similar setup where we know that the country is in crisis and cannot really support research in difficult times. Thank you.
Great, thank you very much. So as we're closing, I'm going to turn to the panel. We have 3 clear questions, and I will just ask the panelists to respond to one of those questions of their choosing. And then if you would just have a final minute reflection, and then we'll invite some closing remarks. But the 3 questions on the floor, number 1, how is health policy and systems research measured? What are the metrics? Number 2, how should health systems situate themselves in the context of broader industry influences when it comes to social determinants of health? And then number 3, how do we foster more support of research in countries in crises context? And of course, we know that we're living in a time where crises have multiple definitions as well, using policy analysis and other methods. So Professor Hoda, why don't I start with you?
I'll share with you my understanding of the difference between social determinants of health and the social determinants of health equity paradigm that we're discussing nowadays. The social determinants of health has been with us for quite a long time, and what it brings to our mind are the social forces as we know them. The education, the income, the poverty, that type of social forces. What the paradigm of the social determinants of health equity have brought to our mind are 2 important distinctions. One is to move into upstream forces. Let's discuss the forces that govern those social determinants of health that we usually discuss, traditionally discussed. The second is about the fairness of those forces. So now the question about what do we measure when we talk about social policies and health system. You have a frame. You need to apply the multi-level framing of health and health inequality, and then you measure whatever influences and contribute to those policies and contribute to the goal. So it's really a very wide domain. The emphasis has been for some time on forces within the country. So the emphasis, and rightly so, on governance reform. I mean, Komanan was talking about health equity as a manifestation of failure in governance. And beautifully said. So basically it's a health, you talk about health system. You talk about the goal of the health system, which is the health distribution, but you frame it within a multi-level frame, so you don't emphasize one aspect of it over the other. More recently, and my colleague who talked about the commercial determinants of health, more recently, there is a realization it's also beyond the governance and beyond the country and beyond the public service. And we definitely need to bring in the commercial determinants of health. We need to bring in environment and climate change. We need to bring in the crisis, which tend to be unfair. Even the COVID crisis itself, with its manifestation, is clearly there is a differentiation in social consequences and in social determinants. So it's all about a general frame that would guide the questions and the analysis of the social and health policy, and health system research. I'm happy to be a member of the advisory group of the commercial determinants of health. And the report, you seem to know what's about, and the report is about to be produced soon. So, but it's very important to focus on it.
Thank you very much, Prof. Hoda. Sita, I wonder if I might come to you next, please.
Thank you. So I would like to comment about the measuring histories. I think that's always a question that we need to ask ourselves as well as histories. I think one of the one of the advantage of being a research institution that is affiliated with academics, affiliated with universities, is that we do have a certain key performance indicators that are mandated to us. So it's not only about publications. These days, the university also imposed to request that we also show evidence that we not only produce publication in journals, but also in the forms of policy briefs and policy papers. And they also ask us to also show the evidence that what we do is actually influencing some kind of policies, be it, participating in policy dialogue, initiating policy dialogue, making sure that our recommendations are being discussed or being cited in these dialogues, and that our recommendation was actually put into regulations that are enacted. This kind of evidence are now being asked to HPSRs that are affiliated with universities. So that's one of the advantage. I think it's easier for us now to measure that kind of impact. And I think the other thing that we can probably measure the success of HPSRs is that, again, to what extent they have expanded their kind of look and their kind of perspective and their kind of network outside the health system, as Professor Hode and Dr. Aris also mentioned. The idea that we could only address health system issues or challenges with just the Ministry of Health is not a traditional way of doing things. It's not business as usual anymore. We need to go beyond that. So we need to also show that we have new links, we have new connection, new networks that is connecting us as HPSRs to Ministry of Finance, Ministry of Home Affairs, Ministry of Planning. This kind of connection that we need to show, we have to have new networks and new established relationship with policymakers. These kind of things kind of push us to go beyond our comfort zone, if you will, and making sure that we are addressing health system and health policy challenges, not just by, a very, very narrow lens, but, looking at it from a broader perspective. So I think that's one of the ways that we can measure HPSR's success. Thank you.
Excellent, Cesar. Thank you so much. And then Dr. Arash, if we can end with you, please.
Yeah, very good questions and important insight. And I was thinking that how in a short time you can say something that is really useful. As I said, I come from a health policy system research background, so from the academic side of it. But during my academic life, I also worked very closely with policymakers. Now I'm in the policy business within WHO for many years. And I tend personally, and I think within WHO program, I've avoid the dichotomies that we usually make. So let's say, to all of us agree that social determinants are the key important factor of all the health outcome, much more than health issues. But then in the end, a policymaker is going to make decisions that are going to alleviate them or not to make them worse, because health system can actually make it worse as well. And who is that policymaker? Is within health system. So you cannot, they cannot be separated from each other. The same goes with the issue of, between policymakers and academics. Again, if you frame the question and the way that you are going to answer it more comprehensively, as you mentioned, in a way you bring all of those together. WHO is doing a great job now for the commercial determinants of health, as a report that is upcoming that colleagues refer to. But even right now, there are several ways of avoiding the influence of commercial interests in policymaking that we are not adopting really well. So when we talk of the policymaking processes, if we adjust the policymaking processes to avoid such influences, then in a way we are addressing many of those already. So to the way that we look at it is that when we talk of institutional capacity, it's not about research institutions' capacity to do research. It's not about having expert people sitting within the Ministry of Health. It's all of those together and everything that goes in between. It's about having people that understand, people that can apply it, but processes that would make sure it will happen. It becomes a big thing, but then it also allows you to bring everything together. And that's the sort of the process that we all want to go together. And what I really want to say is that, again, as someone that has been in this business for many years, what I see now is much more sincere interest in the topic, much more knowledge in applying the topic, and of course, many more questions that now have appear to us that we need to answer. And that becomes also a lot the role of the Alliance to address.
Thank you very much, Dr. Rash, and thank you all of you. So just by way of summarizing, very complex questions and issues that were raised here, but some commonality across them, and it's about sort of multiplicity of frames, as Prof. Hoda said, multiplicity of capacities, and do we have the processes that we need to be able to conduct and practice health policy and systems research, but then also multiplicity of measures, that it's not just about how many people are trained or how many publications are written, but really are we able to show and demonstrate impact in the various ways that it would be manifest. Finally, just closing, saying that we do have much more interest and sincerity in the domain of health policy and systems research, a clear sign that the field has evolved, but that there's still interest and need to continue to go forward for another 25 years. And then just to quote our colleague here who said that health policy is health. And so there's a need for us to go beyond the health system in order to sustain the health gains. So audience, please, can you join me in appreciating our esteemed panel this afternoon? And so this now brings us to the end of our session. We will just have final reflections again from Dr. Kumanen, and then to close, we will give it to Professor Fadi. So Kumanen, please. Yes. Yeah, you can get the buttons under. No, here.
Right. Always have to get the terminology right. So thank you so much to our panel. We have a very esteemed panel, and thanks to all of you for spending your time this afternoon with us. I think just to conclude, when we reflect on the future, is that what we are trying to do, and where this conversation is so useful, but we encourage all of you, both here and online, to continue to engage with us, is that through this year, we will be developing the new strategy for the Alliance to guide our next 25 years, starting with the next 5 years. And I think the issues that you've raised are very helpful. So I reflect that the period of the Alliance is actually about the length of my professional career since I graduated from medical school, about 25 years. And when I graduated from medical school, I didn't know what health policy and systems research. And then after a few years of clinical practice, about 22, 23 years ago, my first public health work was running vaccine controlled trials, randomized controlled trials. And I still didn't know what health policy and systems research was. And then after we did finish the trials, I actually worked on the rollout of that vaccine once the safety and immunogenicity was proved through our trials. And then I realized at that time, wow, that the trials were so different to the way we were delivering the vaccine. And so I reflect very recently with our COVID experience that, again, that disconnect between the sort of clinical research or even our knowledge of what to do and then how to do it and the context, that is exactly the business of health policy and systems research. And thank you, Dr. Abdi Nazir, for joining us. I know you have a very busy schedule as the head of the WHO office, and we're honored to have you here. And with your experience from COVID, I would say to you that more recently, at this side of my career, I was incident manager for WHO in Cambodia for COVID at the beginning of the pandemic. You had a very big job looking at the whole region. And I also, in that period, in February and March 2020, I wasn't doing health policy and systems research. I was running, like all of us, to try and do the plan, get the money, get the commodities, do the trading, what was going to happen. And yet, And that was in a time when I knew a lot about health policy and systems research. I think our challenge going forward with all that has been achieved is to say we have a method, we have a field, we have a community, we have a network that can deliver, but it's to make that more visible, make that more known, and say that we are a vital cog in health policy and systems research to translate between the sort of high-level what into the how, into the context, which is what we all do every day in setting policy, in implementing programs, and trying to improve programs. The Thais, our Thai friends, as many of you will know, have this concept of the triangle that moves the mountain. And they say to achieve social good, to move forward change in the right direction, yes, you need the government, you need the policy makers, but you also need the people, you need the social participation, and then you need the knowledge, you need the academics, you need the research. And it's the relationship between those three, when you get it right, that moves us forward. And health policy and systems research, dare I say it, is a field that specializes in understanding those relationships, understanding those feedback loops, the interests, the obstacles, the incentives that move behavior. So it's not enough just to have the knowledge, to have the paper, even to have the nice presentation. It is actually about relationships and people, and how do you change hearts as well as minds. And I think we've seen that. If we didn't understand that in 2019, after 3 years and all the challenges and all the millions of lives we've lost unnecessarily in this pandemic, when we look at the challenge in this region of all the emergencies, Professor Hoda, you said it's so hard to speak when so near to us in so many places people are suffering with these crises. We hope to work with our EMRO colleagues on taking policy and systems research approach to emergency management. So there are fields that we should continue to do, but there are fields like the commercial determinants. My colleague Robert Martin was part of that Lancet series and author on 2 of the papers. We're supporting Dr. Monika Kosinska, who is the lead for WHO on commercial determinants at HQ, on the research agenda for commercial determinants, including regional and local perspectives and how we will contribute to that report. So I think that is our challenge. The last question, and the questions are a good frame for my reflections. You said, can you do this sort of work in places in crisis, in countries that are struggling, which have real challenges? But you have here in K2P, in this building in AUB with Professor El Jadali and this amazing team here, who are every day showing that you can do that, right? Who are every day, they are not just leading in this country, they are not just leading in this region, they are one of the global leading institutions for health policy and systems research. And I'm not just saying that because they're hosting us so well and feeding us so well, but that is a truth. And you should all be so proud sitting in this room, in this country, in this region, of the strengths of these institutions. You have institutions like the American University of Beirut. I've known Professor Rashad now, I think, since 2006 or 7 with the Commission on Social Determinants, who's such a global leader and champion for work on social terms and health equity and knows so much. And I'm so pleased to see you again. You have a strong regional office in EMRO with, real leadership, technical and scientific leadership. Our job is just to facilitate, to support, to connect, to synthesize. And so we hope that you will walk with us, join hands with us over the next 25 years. And build on the achievements of this community, join in this community, and ensure that health policy and systems research doesn't just have good methods, doesn't just have a nice symposium, doesn't just have a nice network, but is producing the impacts on policy that our colleagues from 7 countries were discussing this morning. But we can scale that impact and really make a difference to address the suffering of people and to improve health and health equity. So with that, I'll hand over to my friend Fadi to give the vote of thanks. Thank you so much to the AUB and K2B team and all of you here and online. And over to you, Fadi. Thank you so much.
Thank you so much, Kumran. You said it all. What I wanted to say that it's 3 things actually. First of all, thanks for all the insightful reflections that came from the panelists, and I think we're going to continue that conversation moving forward. Tomorrow we're going to have very focused strategic meeting that will be led by the Alliance, talking about the strategic shifts. So much of those discussions and thoughts will be also brought to bear into this discussion. So thank you so much. And thank for the Alliance for continuing that conversation, for having a Beirut stop after London and Oslo, for continuing and engaging with the global community when it comes to health policy and systems research. Three realities I would actually say about our region now. That health policy and systems research is here, will stay, and will continue to evolve in terms of production. The second reality is that more and more academic institution, civil society groups will be engaged and is engaging in producing and using health policy systems research. And the third reality that more and more efforts and platforms will actually utilize and make use of that evidence to inform, shape, influence, and affect policymaking in the region. I think these are three realities we cannot deny anymore. We are supporting and we will continue to actually evolve and scale up. One last comment I want to mention, and thank you, Kilman, for mentioning about the work that we're doing in EUB and beyond. But I have to say that we, you're celebrating 25 years, 25th anniversary when it comes to journey of health policy system research, the Alliance. But I have to say that we couldn't have done much of what we're doing now and where we are now. If it's not because of the support of the Alliance for Health Policy and System Research. So it was really a pleasure, honor. We were so delighted with this work that we have done with the team from the Alliance, with the support. But looking backward, we're so proud of the achievement. But moving forward, we're so happy that we're going to continue to engage that in conversation. We will continue to help shape some of the priorities as well for the Alliance moving forward, with a focus also on what is needed in the Eastern Mediterranean region. And we will continue also looking forward to continue working with you in the next 25 years and beyond. Thank you so much. Thanks for all the participants for being here. We're so happy. I think there's coffee and snacks out there. Thank you.